there's a conflict between the mission and the money, and it's yet to be seen who's going to win and how that's going to impact patient care, which is what it boils down to me. If quality of care improves, ownership doesn't matter.
We live in a system that is so capitalist and for-profit dominant, and where you can potentially end up playing whack-a-mole, squashing down one mechanism by which people are profiting off of people who are seriously ill and dying in ways that are concerning.
The problem, it's that you have over 300 hospices in one county, which is just insane. And let's be honest, the especially like in the hospital setting, the way people in hospitals get selected into hospices, it's not Medicare Compare, it's not a quality metric, it's who can admit this patient as fast enough so we can decrease our length of stay in the hospital. How do we define what palliative care is? Is it just like, somebody calling up and, setting somebody a squeeze ball? Which I have seen as somebody wanting to label that a palliative care clinic.
Always make sure you're still close to the action. Abraham Lincoln was always one of my heroes. Abraham Lincoln had this amazing team of rivals, of leaders around him, but he had this news reporter and people on the battlefield that had the backdoor access to him, that it was ability for him to know what was really going on. He would go out himself. Those are great leadership lessons. And we live at a time where everything is screaming at you to go wide. And yet, I'm not saying just go very, very thin, but where you put your influence is going to determine what your impact is on the world. That's a huge leadership lesson. I wish I would have gone back and someone could have told me that in my early 20s.